One, two, three, testing. Smile. Hello learners, thank you for joining me for a hands-on course or session on toothbrushing for maintaining oral hygiene that comes under HLT DEN 028, provide effective oral hygiene instructions to patients with an oral treatment plan. So before we begin, let's get together for the acknowledgement of country. I acknowledge the First Nation people, elders, leaders of all ages, as traditional custodians and keepers of the culture and spiritual connect to the land, water and skies of Dark Indian country. I also acknowledge and pay respects to the Aboriginal and Torres Strait Island people. So a quick safety brief. Here's a safety map of our premises. There's one on the wall as well. So in this, it shows that we are in block B of Warnervale Dental. There's an entry and exit just behind me. Drinking water is on the table at the back. Toilets on the other side of the road there. Be careful of your surroundings. There are wires, some furniture. So when you're walking around, be mindful of the wires so there are no trip hazards. In case of emergency, stay calm, follow me, and I'll take you to safety in that demarcated in that area, the B, the area where we go and wait for the emergencies. So it's a safe learning space, so keep everybody safe, and if you have your iPhones or Samsungs or whatever phones you have, keep them on silent for the duration of the session of the Yes. So learning objectives, there are two learning objectives. One is we'll learn various toothbrushing techniques and names and what they do, how they're done. Second is we'll learn and demonstrate effectively how to brush, how to do a brushing technique for a child and an adult, right? So some interesting facts. 3.5 billion people worldwide, they have got caries or dental disease in their permanent dentition. Now this was backed by oral health trackers, ADA's own oral health trackers. 53% of Australian adults have they brush twice a day, whereas ADA Consumer Oral Health Survey reveals 1 to 5 Australians still only brush once or less per day, and those who brush once per day, 40% said that they don't need or want to brush, and 29% of them said brushing causes pain, and 12% brush not more than not enough, and 8% were too busy and forget to brush altogether. So do you have any statistics or any experience you have with your patients or in the clinic you want to share?
So, yeah, I think it's quite common that people usually brush only once a day rather than twice. Very few people do.
All right. What about you, Simran?
I'm good. I don't have any experiences.
All right. What about you? How many times do you brush?
I brush twice a day.
Very good. Okay. So structure of the session is we have begin with the introduction. We'll talk about some oral hygiene aids, brushing techniques. There will be a video to show you a technique that is the BAS technique, which we use for adult toothbrushing, which is recommended. And then we'll do an activity. We'll practice how to brush, hold the brush and clean the teeth. So in case you get a patient in your surgery and they want to learn, you can show them how it's actually done so they can go and practice. And then we'll do phones technique, which is a circular scrub method for children. Again, so one is for adult, one is for children, so you would have both the techniques under your belt by the end of this session. And then we'll watch a review video, so just to refresh our memory that we are doing the right technique right way. And then we'll do check the learning outcomes, and I'll wait for your feedbacks. Now, since you both are here, I have a attendance form here. I would like you to sign in front of your name, so we know that you're here. Yeah. So this is the attendance sheet. I'm also giving you a learner's feedback that you can fill after you have finished the training. Not now, later.
Don't give my name so it doesn't get mixed up.
Yes. Okay. Thank you. I'll keep it here just in case. Yeah. You can use these books too. Okay. So let's begin with introduction. Brushing our teeth is essential part of oral hygiene and dental care. Australian Dental Association recommends brushing twice a day for at least 2 minutes, one before after breakfast and another one before going to bed after dinner. And why do we brush? Because there is a substance called plaque, which is a sticky substance that starts to deposit on our teeth soon after we have brushed our teeth. But if we don't clean the teeth, then we end up having dental caries. ADA recommends that you use fluoridated toothpaste to brush for adults and sugar-free and no fluoride for children. The toothbrush has to be changed every 3 months or when the bristles become frayed, because if you use a frayed toothbrush, it is going to harm your gums and your teeth. Anything, any feedback, anything you want to add to that?
So good.
It's good, okay. So what are oral hygiene aids? Oral hygiene aids are brushes, floss, interdental brush, chewing gum, sugar-free chewing gum, or mouthwashes that help us keep our teeth clean and stop plaque deposition on the teeth. So any other dental hygiene aid you remember that I've forgotten to mention?
A water flosser?
Yes, water flosser is a very good hygiene aid. Okay, so brushing techniques, there are many, but the main ones which are followed in dental clinics these days is a BAS method, and then modified Stillman method, phone circular scrub method, scrub brush method, and roll method, by also called an ADA method. Now, BAS method is something which is recommended by ADA and which is advised to be taught to all adults when they come in for a dental checkup or treatment plan, and when you assess them and they are not doing a certain technique the right way. So what is a BAS method? Before I explain, I would like to show you. Okay. Now in
Open and dry.
Yeah, it was opening just now, but never mind. I will explain the technique. BAS method is a method in which we hold our toothbrush to 45 degrees to the long axis of the tooth. So our tooth, if this is the long axis as the crown comes out, if we put our brush head at 45 degrees, whereas the bristles are just at the neck of the tooth where it is meeting the gums, we keep it there and we do small circular movements back and forth, and we start from one side going to the other. And once we have gone all across, so each time we are moving our brush back and forth in circular motions, we have to count 20. So there are 20 strokes. On the occlusal surface, we do a scrub, whereas on the inside of the anterior teeth, we go up and down. Yeah, same thing with the lower one. We would keep our bristles at 45 degrees and circular motion, circular motion, circular motion. Occlusal surface, we are going to scrub, and then on the anterior, we are going to do a back and forth, like that. Yeah, and once the teeth are clean, then the tongue is cleaned with water and the brush. So the idea is to use a soft bristle brush so we don't damage the gums. The benefit of this is it will clean the interproximal surfaces of the teeth along with the flat surfaces of the teeth, making it a better cleaning method for adults. Now, why it is for adults? Because for children it is too intricate and small movements which they are not capable of at that age. So it's better for adults to do and learn. So normally this technique is taught to young teenagers and young adults, going from there to all adults, all ages of, so except the little children. So let's give it a try. Okay,
Can't open it in browser?
yeah, I was able to.
It's asking you to open in browser. You're
Yes.
pressing that button.
No, I
Open film in browser.
Yeah, that I was doing and it's not.
Okay, connected.
Yeah, that's.
Delay has affected the internet.
Yes, maybe that's the reason. Okay. Yep. Yeah, something's wrong with the internet, but that's alright. I was able to connect it a minute ago, but then it's alright. Anyways, let's go back to our presentation. So the technique, as I was explaining, you place the brush. Let's do this. Okay, are you okay with the big
Yes.
dental model? All right. So 45 degrees to the long axis of the tooth, and small circular movements back and forth as if you're massaging. So this would also massage the cervical margin of the gums, but it will not hurt the gums. So once you've cleaned this, you'll move forward. Yes. Yeah. Okay. So you can hold it like that, and yes. All right. Now on the occlusal surfaces, we will scrub back and forth. Very good. And on the inside, we'll move it up and down. Yeah. And the top as well. Yes, on the top as well. Yeah. So this is the technique used for adults, and it's called BAS technique. Very good. So if I ask you in the end of the session, are you able to demonstrate it? Would you be able to demonstrate
Yes.
it by
Yes.
yourself? Can you feel confident?
Yes.
Yes.
So let's see if this can play. No, it's the same thing, the internet issue. Okay. Who is this technique for? So the BAS technique is basically for young adults and teenagers and adults, and the advantage is it is very effective in removal of plaque from interdental gums and flat surfaces of the gums or all around the teeth, and It also provides good gum massage. It is easy to learn for an adult, and because the technique is designed for adults because they have better manual dexterity. Whereas disadvantage is people who are known to use too much force in scrubbing their teeth, who've already learned a wrong technique. It would be detrimental for them to jump into this technique straightforward. So they have to be slowly introduced into this technique by first just placing the brush and gently cleaning those teeth which are visible, not the furthest in the arch. So something at the front, it's easier for them to see and maintain that scrub motion. And slowly they can go back and start from one side going to the other side. Disadvantages also include that initially it is very time consuming and people are not, they lose patience. And not suitable for people with poor manual dexterity. So modified Stillman is similar to Bass technique. The only difference is here with the brush being at 45 degrees, instead of small circular motions, it is back and forth scrub motion, right? Rest everything is same. You move forward, scrubbing, 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 back and forth. And on the occlusal surface, you're scrubbing. And on the inside, you're cleaning back and forth. Same way on the lower, back and forth, occlusal. On the lower, you place it at 45 degrees on the tooth and you scrub back and forth. So people who are used to scrubbing teeth method, they would pick up this technique quicker than Bass. But effective cleaning is normally done with Bass because in this we don't get proper cleaning of interproximal areas. Okay, so and another thing is it is done from the gum margin towards the crown. So it goes scrub, scrub, scrub down, scrub, scrub, scrub down. Yeah. Now, Phone's technique or circular scrub method, it is a technique which is taught to young adults or children. This technique is very simple. Here, the child is asked to bring their teeth edge to edge. Normally, our teeth are like this, so we'll protrude our jaw and bring our teeth edge to edge. We'll use the brush horizontal to the tooth surface. So this is the tooth surface, this is horizontal. So the bristle head is horizontal to the tooth surface, and small circular scrubbing motion is produced to clean the teeth. So initially it can start from one side at the back, going small circles, then move forward small circles, small circles, small circles. Once it goes from one side to the other, then occlusal surfaces are always scrubbed. Inner surfaces are also scrubbed, and the inner surface of the front teeth is back and forth because you can't do circular movement there. And same thing on the top, and scrub. Yeah. So this is Phone's or circular scrub method. So if you guys like to do it with me, so model, your brush is horizontal to the tooth surface. Yes, you can turn it around towards you. Yes, as if you are brushing somebody's teeth.
Yes.
And then go circular motion. Yes, very nice. Not up and down, circular. So you can think of a clock and go clockwise. Yes, and the edges have to be, the teeth have to be edges. Yeah,
allow me to
yes,
do it much.
that's all right. So, and on the inside, you would do scrub, and on the occlusal also you'll scrub, and on the front you go back and forth horizontally. Yes, but all around the outer surface it is always horizontal and circular motions, small circular motions. So ADA recommends that you do each section 20 scrubs. Yes, and use a soft bristle brush. And this toothbrushing technique is indicated for children, young children, and physically or emotionally handicapped people who cannot learn the Bas or modified Stillman technique, or adults who are not used to that modified or Stillman techniques. It is easy to learn, and it does not require too much time to start and begin in a beginning stage. So disadvantages: if somebody is too aggressive and vigorous brusher, they will hurt their gums or harm their teeth. Also, if you're doing it too fast, you will miss out on the interdental areas and not clean the teeth properly. So scrub method is similar to Fawn's method. The only difference is, instead of circular motion, the teeth are brought edge to edge. The brush is put horizontal and it's back and forth and up and down for the front, and on the side it is back and forth. So the disadvantage of this technique is that when people are overzealously brushing, they end up hurting their gums or their teeth. So this technique is only taught but not given to a patient with a periodontal or sensitive teeth. So another technique is called the roll technique. This technique forms the foundation for Bas or modified Stillman technique, where the brush is kept at 45 degrees on the gums in the vestibule and gently moved away from the gums towards the teeth in a circular motion like this, as if there is a big wheel and the brush is a part of that big wheel. So it's forming a circle, but the wrist also moves. Yeah, and same way from lower to upper. Now in this technique, there's also something very important. You don't keep your teeth together. The mouth is always open, so you do one arch first and then move to the second quadrant, third, fourth, moving forward, or from one side to the other. This technique also forms the base of modified Stillman, because here the patient learns how to gently place the brush at 45 degrees into the vestibule on the gums. So this massages the gums, but again you have to choose. God bless you. If the patient is overzealous in his brushing method, you will not teach this technique to them. Yes. So who's this technique for? This is the technique for people with healthy gums, to massage their gums. And who is this technique not for? It's for people with overzealous brushing methods or habits, and people with poor manual dexterity. So they won't be able to. Unfortunately, I'm not able to play the video. Hopefully I am. No, not again. Okay, that's all right. So a quick review. What are the names of toothbrushing techniques we have discussed today? There is Bas, which is for adults, 45 degrees, small circular motions from one side to the other, scrub on the occlusal surface, scrub on the inner surface, and vertical brushing on the anterior front. Yes?
Yes.
Modified Stillman, here we don't do back and forth, we do circular. We don't do circular scrubs, we do back and forth scrub, right? And then Fawn's technique, which is for children, where we bring our teeth edge to edge, put our brush horizontal, and go small circular motions, keeping the bristles just on the teeth, not going on the gums like that. Yeah, small circular motions. And then we have scrub method, where the brush, instead of going in circles, goes back and forth and up and down. And then we have roll method or ADA method, where the brush is kept on the gums in the vestibule at 45 degrees and moved away from the teeth in a circular motion. So these are the brushing techniques we have discussed. So what are the two brushing techniques which are used for adult and child?
Two each for
No,
adults.
one.
So Bas method for the adults.
Yes,
And phones for the children.
very good. And would you be able to demonstrate if I ask you to?
Yes.
Yes, can you show me the phones method, please, for the children? So turn it this way. Yeah.
That's just circular motions.
Yes. Yes. Very good. From one side to the other. Yes.
And scrub on the occlusal surface.
Very good.
And back and forth.
Yes. On the front,
Yes.
anteriors. Yes. And what about the top?
The top as well.
Yes. Very good. So anything which is cleaning, any cleaning that happens inside is similar to the down and the
Yes.
lower jaw and the upper jaw. The only difference is on the outer surface we are doing horizontal placement of the brush and small circular movements.
Yes.
So 20 movements per a small area, and then you move forward. Okay, how about Bas method demonstration for us, please?
So that is for the adults.
Yes.
And we place the brush on 45 degrees to the horizontal axis of the tooth.
Very good.
And then you do very small circular
Circle.
motions.
Yes.
20 strokes for every one or two teeth
Very
of the
good.
brush.
Yes.
And like that you go from one side
To
to
the
the
other.
other.
Very good.
Then we go on the inner side, so on the occlusal surface, basically scrubbing like that, even on the top teeth. On the inner side, that's scrubbing, especially here, back
Yes.
and forth, back
What?
and forth.
Yeah, keeping the brush vertical.
More vertical.
Yes.
Same on the top.
Yes. Very nice. Very good. So you're feeling confident with the technique. So in case you see a patient who wants to learn this technique, you'll be confidently, independently be able to demonstrate and teach the technique.
Yes.
Yes.
Okay. Very good. Well done, guys.
Now, just a question. So, with the
Yes.
people with manual dexterity problems,
Yes.
so what are the, because all of them were saying that these
Yes.
can't be performed.
So for them, we use the children's technique or the phones technique, where the patient can have small or large circular movements on the outer surface, which is easy for everyone to do, because here you're not moving your wrist, you're holding the brush the best way you can. People with osteoarthritis in their hands, it's easier for them to do that. There are certain designs of the brush handles which are a bit bulkier, so they can hold it comfortably without any joint pain. And on the inside, it's just scrubbing. So they can scrub inside and clean upwards. Some people like to hold their brush like a pen, and while cleaning the lower anteriors, and they can hold the brush like a palm and thumb grip for the top, depending upon how they are comfortable using the brush. Yeah, good question. Okay, so learning outcomes we have discussed, and you are able to name and talk about the toothbrushing techniques, various toothbrushing techniques. You are also able to demonstrate effectively the toothbrushing techniques indicated for a child and an adult. Very good, very well. Yes. So next session is HLT DET001, Constructing Model, Release 1. We'll do that in a short while. And I have given you some feedback forms. It's also in your email, so please feel free to give me feedback, and then I can submit it with my assignment. And this is for me. Thank you so much. Thank you for the session. Hope you had a good time.
Yeah.
Okay. Thank you.